الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Alcoholism and Drug Addiction, Professor Mahmoud Hani Sulaiman. Definitions: drug is substance other than food when consumed produces changes in physical, mental functioning of individual. Drug use equal taking drug for medical purpose as treatment of illness or relief of pain or tension or protecting body from disease. Drug abuse is taking drug for non-medical reasons in amount, strength, frequency, and manner that leads to damage of social, physical, and mental functions of the individual. Drug addiction equal result of drug abuse which lead to both dependence and tolerance. Drug dependence is a state due to interaction between a living organism and a drug leading to response that always makes compulsion to make drug continuously or periodically, compulsion to take drug continuously or periodically, to experience its psychic effects and often to avoid discomfort of its absence. Drug dependence can occur for more than one drug. Drug dependence are of two kinds, physical and psychological. Physical dependence occurs when abuser's body becomes accustomed to a particular drug and he requires drug in increased doses over time for normal functioning or to obtain same results as earlier. Dependence because of development of tolerance to the drug. Tolerance requiring more and more of drug to get same effects. Abrupt stopping of drug leading to variety of adverse effects known as withdrawal symptoms as cramps, tremors, pain in abdomen, sweating, depression, etc. His whole life is focused on drug procurement and use, how to get drug and use it. Psychological dependence occurs when drug is so central to person's thoughts, emotions, and activities that is extremely difficult to stop using or even stop thinking about it. Psychological dependence is marked by an intense craving for the drug. Addiction as a disease. In 1956, addiction declared as a disease by American Medical Association. It is disease which can be treated. The features of this disease are: it is primary, permanent, progressive, and terminal. Primary, permanent, progressive, and terminal. Primary disease, that's to say not symptoms of psychological disorder, but a disease. It can lead to mental, emotional, psychological problems. Mental, emotional, and psychological problems. These problems cannot be treated unless addiction is treated first. Permanent. It cannot be cured but successfully can be arrested. It is progressive. The disease invariably follows course of serious deterioration over a period of time. Terminal. Addict may die due to any complication, but factor which induces complication itself is the abused drug. Types of drug abuse. Too much, too long, wrong use, wrong combination, wrong drug. Too much, too long, wrong use, wrong combination, wrong drug. Too much, taking too much of drug at a time or taking too frequently can lead to fatality, e.g. sleeping pills. Too long drugs abuse, if taken over a long period of time, leading to serious problems, e.g. PTSD. Wrong use, drugs abused if taken for wrong reasons or without proper instructions. Wrong combination, drug abused if taken in a wrong combination with other drug. Wrong drug use of a drug like brown sugar, which has no legitimate use, itself is drug abuse. Reasons of drug abuse are easy availability, curiosity, emotional pleasure, social or group pressures. Easy availability, curiosity, emotional pleasures, social or group pressures. It is more common among teenagers, and abuse of multiple drugs is also increasing. Other risk factors for drug abuse are unemployment, broken home, parental deprivation, migration, working in drug stores, genetic predisposition, etc. Prevalence of drug abuse. Alcoholism and abuse of psychoactive drug is a global problem. About 20 million people smoke marijuana in US. About 40% of high school students in US accepted marijuana as a part in their life. In India, for example, about 40% of college students addicted, and it is on increase. Abuse in Egypt. Most commonly used substance in Egypt is nicotine, reaches 9%. After exclusion of nicotine comes benzodiazepine, is the commonest substance abused, 5%. Then alcohol, 3.3%. Organic solvents, 3.1%. Cannabis, 2.6%. Prevalence use of any substance is 1.5, while prevalence of dependence syndrome is 0.9% if we exclude nicotine dependence. Prevalence of intake, regular use, and dependence are all higher among males. Identification of drug abusers. Academic changes, physical changes, withdrawal symptoms, other changes. Academic changes, physical changes, withdrawal symptoms, other changes. Academic changes, poor attendance at school, decline in academic performance. Physical changes, slurring speech, sweaty eating at night, loss of appetite, reddening of eyes, unsteady gait, fresh injection sites, temper tantrums, puffiness under eyes. Withdrawal symptoms like tremors, cramps, GIT symptoms, pain, abdomen, sweating, depression. Other changes: blood stains on clothes, disappearance of articles from home, odor on breath and clothes, presence of needle shearings, etc. at home, presence of solitude, especially spending long time in the toilet. Dependence producing drugs. What are the drugs that produce dependence? According to ICD, 10 drugs: alcohol, opioids, cannabinoids, sedatives or hypnotics, cocaine, stimulants, hallucinogens, tobacco, volatile solvents, and others. Alcohol. Depending on quantity consumed, alcohol is sedative, tranquilizer, hypnotic, or anesthetic. Alcohol is the only drug whose self-induced intoxication is socially acceptable in some communities. Alcohol is rapidly absorbed from stomach, so detected in blood in a couple of minutes, and maximum concentration reached in about 1 hour of drinking. Presence of food in the stomach decreases its absorption by dilution. Alcohol effects. Alcohol has marked effect on CNS. Concentration differs in different types of whiskey. Alcohol leads to delirium, psychosis, paranoid schizophrenia. Adverse effects are acute and chronic intoxication, toxic psychosis, cirrhosis of liver, gastritis, pancreatitis, cardiomyopathy, peripheral neuropathy. Intoxication, toxic psychosis, cirrhosis of liver, gastritis, pancreatitis, cardiomyopathy, and peripheral neuropathy. Consider carcinogen leading to cancer of esophagus, mouth, pharynx, and larynx. Cancer of esophagus, mouth, pharynx, and larynx. Social adverse effects are automobile accidents, injuries, suicides, deaths due to violence, family disorganization, and crime. It affects pregnancy by abortion, fetal alcohol syndrome. Abortion and fetal alcohol syndrome. Fetal alcohol syndrome consists of microcephaly, growth retardation, mental retardation, valvular disease. Opioids consists of opiates and other narcotic, hypnotics, analgesics. The source of opiates is opium. The active alkaloid is morphine. Morphine, petidine, heroin, codeine, methadone are all narcotic analgesics. Narcotic analgesics. These drugs block pain receptors in brain and relieve pain and induce sleep. These drugs result in psychic dependence. Very soon and very strongly. Addiction to heroin is the worst type because it produces craving. The drug fentanyl is 10 times as potent as heroin. Cannabinoids. Cannabis obtained from dried leaves, flowers, tops, and stem of hemp plants. Cannabis sativa, Cannabis indica, Cannabis americana. Resinous oxidate from flowering tops of female plant contains hashish. Term marijuana, any part of plant which lead to somatic and psychic changes in individual. When marijuana inhaled leads to intoxication in minutes, lasting for about 4 hours. Oral consumptions lead to delayed onset of action but lasts longer for many hours. It leads to relaxation, euphoria, tendency to laugh, and interference with perception of both time and space. It leads to psychic dependence, and death is rare. Sedatives or hypnotics. Commonly used sedatives are barbiturates, which are derivatives of barbituric acid. Next common is diazepam. Barbiturates leads to both physical and psychic dependence. Cocaine is alkaloid obtained from leaves of coca plant. Erythroxylone coca, formerly used as local anesthetic. It stimulates CNS, leading to excitement and hallucinations. It does not produce dependence, so no withdrawal symptoms. Pure cocaine is smoked, while popular cocaine hydrochloride is snorted. It's being sold in Bolivia and Peru. Stimulants. Commonly employed stimulants are amphetamines. They stimulate CNS, leading to mood elevation, sense of well-being, increased alertness, relief of fatigue, and boost self-confidence and energy. Since they increase endurance, they are often called Superman drugs, thus leading to psychic dependence. Commonly abused stimulants are dexedrine, benzedrine, and methadone. Dexedrine, benzedrine, and methadone. Hallucinogens. Drugs which alter normal structure of perception, leading to visual and auditory hallucinations, panic reaction. Hallucination is perception in absence of corresponding stimulus. Colors are heard, music becomes palpable, sound is tasted, smell is seen, sights are smelled. Thus, there is depersonalization. The important hallucinogen is LSD obtained from ergot on rye grains. It is impregnated in piece of gelatin or blotting paper kept under tongue and chewed. LSD is only psychotogenic agent and does not result in physical dependence. Tobacco. Tobacco use all over the world. Its use is legalized even though it is causing more deaths than all other psychoactive substances combined. Tobacco contains active principles which lead to various types of cancers as lung, cancer, esophagus, and other diseases like stroke, chronic bronchitis, myocardial infarction, aortic aneurysm, peptic ulcer, low birth weight babies among pregnant mothers. Passive smoking is as dangerous as active smoking. Habit of tobacco consumption decrease in developed countries and increase in developing ones. People tend to misjudge effects of tobacco because of long latent period before happening of these bad effects. The withdrawal symptoms due to decreased nicotine are irritability, anxiety, headache, tremors, lethargy. Irritability, anxiety, headache, tremors, and lethargy. Craving continues for several months. Volatile solvents. These are liquids that release vapors which are inhaled directly or poured on clothes then sniffed. Examples of inhalants are petrol, diethyl ether, nitrous oxide, kerosene, typewriting correction fluid, cleaning fluid, paint thinner, varnish. Again, examples of these inhalants are petrol, diethyl ether, nitrous oxide, kerosene, typewriting correction fluid, cleaning fluid, paint thinner. Initially, there is euphoria, exhilaration, then confusion, disorientation, and ataxia. Some inhalants like petrol and toluene can lead to delusions and hallucinations. Increasing doses can lead to coma and death. Sniffing lead gasoline can lead to lead encephalopathy. Other drugs, these include anabolic steroids and caffeine. Anabolic steroids are synthetic testosterone. They are taken orally or parenterally. They improve muscle tone and physical strength stamina. Usually, such drugs are used by athletes. Caffeine, this is another drug widely used globally in form of tea, coffee, cacao, and cola. Tea, coffee, cacao, and cola. Ingestion of caffeine over 500 milligrams per day leads to caffeinism, which include anxiety, restlessness, insomnia, etc. Withdrawal of caffeine produces headache, nausea, irritability, and lethargy. Health hazards of dependence. These are physical, mental, and social problems, not only to himself but also to family and community. It progresses from bad to worse. The condition deteriorates seriously, leading to tragic event. Reasons: curiosity, social pressure, emotional pressures, group pressure, easy availability of drugs. Features: poor attendance, decreased efficiency, slurring of speech, tremors, loss of appetite, loss of weight, sweating, unsteady gait, fresh injection sites. Other changes are loss of materials from home, presence of syringes, needles, blood stains on clothes, preference of solitude, spending long time in toilet, etc. Prevention and treatment of dependence and abuse. Prevention at individual level for addict. The measures: identification of drug addicts and medical care. Medical care consists of their detoxification by using drug disulfiram for alcoholics. When alcoholic is on this drug, consumption of alcohol gives rise to severe reaction, including nausea, vomiting, tremors, hypotension, and diarrhea. The fear of recurrence of such reaction deters him from taking alcohol. Detoxification can be done in hospital only, still relapse rates are high. Post-detoxification counseling and follow-up. Addict is made aware of long-term hazards of drug. He is informed about his responsibility to safeguard his health by quitting the habit. This detection procedure consists of the following steps: identification of drug addicts, motivation for detoxification, hospitalization, provide of fear therapy, psychotherapy, counseling, medical treatment, change of environment of the addict, post-detoxification counseling to prevent relapse, rehabilitation. Rehabilitation, this is given if he has lost his job. He is given skilled training and placed in appropriate job. Rehabilitation is a difficult process because relapses are frequent. Vocational training and sheltered work are useful in such addicts. It helps to prevent relapse. Substitution in case of addiction to dangerous heroin, less potent methadone is substituted. This enables to resume his place in the family and society because methadone is legal and less dangerous. Family level for prevention of abuse and addiction. Family level, parents are educated about need to shower love and affection on their children, on their sons and daughters, and be neither too strict nor too lenient with them. They should tell their children that they disapprove drugs. Community level for prevention of addiction and abuse. Following measures are implemented: educational approach, service approach, and legal approach. Educational approach, service approach, and legal approach. Educational approach, public informed through campaigns on TV and social media. Educational programs arranged for school children and students at universities. Schools with help of police should make school and surroundings a drug-free zone. Service approach, teen centers and self-help groups. Service approach through teen centers and self-help groups. Teen centers to be established to attract these teens, and they are made healthy and active by sports, music, athletes, artistic activities, etc., and they prevent them from drifting into drug taking. Self-help groups established consisting of ex-addicts encouraging who want to give up drug abuse. They will be influenced and leave habit in course of time, and they lead a sober life. Legal approach, legislation directed at various levels. Legal approach at various levels. Manufacture, distribution, prescription, price, advertisement, and consumption. Manufacture, distribution, prescription, price, advertisement, and consumption. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.